Multiple tools, trailers, gas cans.
Well, I'm hoping this share screen works because the last one didn't. And I ended up recording everything just without my face. This is my vulnerable populations chart that I put together. It was very enlightening, and I enjoyed it. I started with hold on. I started with migrant health. Over here I have migrant health and how it's related and how it predisposes people. It does definitely make them vulnerable to infectious diseases. They do have a lack of access to medical care. They're definitely vulnerable to poverty and homelessness, which in turn, low-paying jobs, can lend themselves to having, again, a lack of access to medical care, increasing their vulnerability to infectious diseases. There was a study done by Agudelo and Suarez in which they did determine that the migrant health workers definitely faced individual and structural barriers, and those barriers need to be addressed. The next vulnerable population I addressed was the infectious disease, people with infectious diseases. Those with infectious diseases don't necessarily make them vulnerable. However, those infectious diseases can make them vulnerable to homelessness and poverty, especially if they have an inability to work. And this is a circular here because the inability to work leads them to decreased access to medical care. Poverty itself and homelessness lends them to further vulnerability to continued and worsening disease processes. Homelessness itself lends to, where I addressed over here, it lends itself to the actual, right here, sorry, down here, homelessness to violence, addiction, infectious diseases again, which is what makes it circular. Homelessness, poor living conditions, poor nutrition, lack of access to medical care. Those are all definitely vulnerabilities that the homeless have to work through. Addiction, needle sharing leads to further infectious diseases, again, leading to all of these other things I mentioned over here: poor living conditions, poor nutrition, lack of access to medical care. Addiction itself lends itself to self-medication, homelessness, and violence. I've seen many a patient who were homeless come in having been beaten and abused in order to have their items stolen. The next vulnerable population is those who are subjected to violence. Violence lends itself to mental illness. There's a study, and in fact, the CDC has a website that gives you the predisposing factors, and those who are subjected to domestic violence have an increased risk of depression and anxiety. Economic distress is the number one cause for domestic violence. It's the domestic cycle: abuse, apology, abuse, apology. Unfortunately, it's a continued cycle that goes on. Violence lends itself to addictions to drug and alcohol, or they're vulnerable to it. Again, the mental illness comes into play: mental illness, drug addiction, abuse, self-medication because of depression and anxiety. Self-medication is a huge problem with mental illness, especially if they don't have access to medical care. They self-medicate. Definitely that is a huge societal problem. The next subject that I addressed is the life in a rural setting, which we saw the video, and we saw the gentleman who had had a heart attack, and he lived so far away, and his wife was blind and diabetic. They are more inclined to be living in poverty situations. Statistically, rural settings are poorer. Infectious diseases are definitely a vulnerability. They have a huge distance to healthcare. They have a major shortage of primary care. There's a study done by McDowell, Glasser, Fitz, Nielsen, and Hunziker, in which they talk about 75% of those who responded to their survey did indicate there was a huge deficit of primary care, which in turn leads to a gigantic deficit of specialty care. Their distance to healthcare. They also have a higher rate of multiple chronic conditions because they live in areas where there's environmental hazards, and there are an increased number of elderly. The ruralhealthinfo.org has many statistics on a lot of how a lot of elderly live in the rural settings. There's definitely fewer resources. The next area that I addressed is mental illness. Again, mental illness is a circular. It definitely leaves people vulnerable to homelessness and poverty, inability to hold down a job. They definitely have a decreased access to healthcare, especially if they can't hold down a job. The poverty, the homelessness leads them to infectious disease vulnerability. Self-medication leads them to the infectious disease vulnerability. Addiction to pharmaceuticals or non-pharmaceuticals because of decreased access to healthcare and self-medication. So this is a circular here. Mental illness is a huge aspect of the vulnerable population, and either homelessness leads to mental illness, which leads to addiction, or mental illness and homelessness. It's a huge cycle. The next aspect that I addressed was poverty. Poverty, living below the poverty level, lends itself to being vulnerable to violence, specifically domestic. I addressed that down under the other category, increased stress related to a decrease in monetary income. Poverty leads to vulnerability to infectious diseases because of poor living condition, access to, lack of access to medical care. It's a huge, huge combination of things that we could go into for days. I could have done this project for weeks and never been done. Lastly, the vulnerability of those with addiction. It does lend themselves to being vulnerable to infectious diseases, specifically with needle sharing, HIV, hepatitis C. Addiction can lead to homelessness because of loss of social support, loss of their job, money spent on drugs and alcohol. Addiction, when you get to the homelessness, it can lead to violence. Poverty, again, domestic violence, infectious diseases. All of these are intertwined amongst each other, amongst themselves, in combination with one or the other. Migrant health, predisposed to infectious disease. Mental illness, predisposed to addiction. Poverty, infectious disease, migrant health, poverty. It's all, I could have done this chart for days and hours and had arrows and significant relationships between all of them. It's all related, and working on one thing individually after another, it definitely, I think, hopefully will at some point make a difference. Thank you.